In this presentation, we will continue with the introduction to social determinants of health. We have two learning outcomes for this presentation. We will define upstream, intermediate, and downstream determinants of health. We will distinguish between modifiable and non-modifiable risk factors. As we go through this presentation, please take some notes. There is one rhetorical question in the slideshow and a reflection. At the end of the slideshow, there will be an interactive activity. There will also be other activities later in the week. Let's talk about upstream determinants of health, or sometimes referred to as distal determinants of health, intermediate and downstream determinants of health, which are sometimes referred to as proximal determinants of health. Risks to health do not occur in isolation. The chain of events leading to an adverse health outcome includes both proximal and distal causes. Proximal factors act directly or almost directly to cause disease. They occur at a more micro level and include one's genetics. Distal causes are further back in the causal chain and act via a number of intermediary causes. They occur at a macro level and include global forces and government policies. Upstream determinants of health includes culture, politics, and infrastructure, government policies, and so on. These are furthest away from an individual's health status or society. They will determine the provision of education, housing conditions, air quality, access to food and water, road safety, employment, and access to health care. The individual is not in control of these factors. Mainly, the government is responsible for these factors. Intermediate determinants of health include things such as relationships, social context, and so on. Examples include community factors, including those related to work, school, family, and peer environment. Downstream determinants of health includes the individual's behavior, capabilities, attitudes, genetics, and other direct biological threats to health. These are closest to an individual health status, and the individual is actually in control. This includes things such as lifestyle, hygiene and eating habits, exposure to disease vectors that can cause diarrhea and other diseases such as malaria. To summarize what we have just discussed, factors that lead to someone developing disease on a particular day are likely to have their roots in a complex chain of environmental events that may have begun years previously, which in turn were shaped by broader socio-economic determinants. For example, society and culture are linked to certain drinking patterns, which in turn influence outcomes such as coronary heart disease via physiological processes such as platelet aggregation. Clearly, there are risks over which an individual has at least some control, for example, inactivity, and risks that mostly or entirely rest at a population or group level, for example, exposure to ambient air pollution. It is essential that the whole of a causal chain is considered in the assessment of risks to health. The widely used model by Whitehead et al. From 1991 also explains social determinants of health. They talk of layers of influence on health. They describe a social ecological theory to health. They attempt to map the relationship between the individual, their environment, and disease. Individuals are at the center with a set of fixed genes. Surrounding them are influences on health that can be modified. The first layer is personal behavior and ways of living that can promote or damage health. For example, choices to smoke or not. Individuals are affected by friendship patterns and norms of their community. The next layer is social and community influences, which provide mutual support. for members of the community in unfavorable conditions, but they can also provide no support or have a negative impact. The third layer includes structural factors such as housing conditions, access to services, and provision of essential services, which can also affect an individual's health. Let us look at this case of malaria. Think about the different social determinants of health that may contribute to the spread of malaria at various levels. Type your answer in the discussion forum, My Personal Learning Journey. Malaria is a mosquito-borne disease that spreads when uninfected mosquitoes bite infected humans and become carriers of malaria. Infected mosquitoes then transmit the disease by biting uninfected humans. Therefore, in order to prevent malaria, people must protect themselves against getting mosquito bites. This exercise is designed to have you think beyond the individual's level modes of disease transmission, that is mosquito bites, to the more upstream social determinants of health or infrastructural factors that may put people at a greater risk of being bitten by malaria mosquitoes. Throughout the presentation, we've been talking about risk factors. Let us define what is a risk factor. A risk factor is any attribute, characteristic, or exposure of an individual that increases the likelihood of developing a disease or injury. Health risk factors are attributes or characteristics or exposures that increases the likelihood of a person developing a disease or health disorder. Behavioral risk factors are those that individuals have the most ability to modify. Biomedical risk factors are bodily states that are often influenced by behavioral risk factors. Non-modifiable risk factors include things that we cannot change. These include our age, ethnicity, family history, and gender. Modifiable risk factors are linked to our behavior. These are things that we can change. For example, physical activity can improve one's health. We also know that things such as smoking, alcohol, salt intake, saturated fats, socioeconomic status, potassium intake are things that one can change to improve one's health. Let's look at this example of risk factors for HIV. Behavior and conditions that put individuals at greater risk of contracting HIV include having unprotected sex, having another sexually transmitted infection, sharing contaminated needles, receiving unsafe injections, experiencing accidental needle stick injuries. All these are risk factors for HIV. Reflection for this section. In one sentence, reflect on what you have learned. Type your answer in the discussion forum. Have a look at these videos that further explain social determinants of health. Now you can complete the drag and drop activity. Take a few minutes to look at the answers for the example of malaria case we discussed earlier in the presentation.